The opioid crisis. In 2015, more than 33,000 people in the United States died from opioid overdoses. In 2014, the National Survey on Drug Use and Health estimated that more than 10 million people in the U.S. use prescription opioids for non-medical purposes. And since 1999, opioid-related suicides have more than doubled. The United States has an opioid crisis. Now, the federal government has gotten involved to curb this crisis, but as the problems continue to worsen, states have been forced to create their own policies to solve their problems. If we look at some specifics, the state of Maryland authorized the Baltimore Student Harm Reduction Coalition to educate people on opioid overdose and naloxone distribution. Researchers took a look into the program, and what they found was that participants had their self-efficacy surrounding opioid overdose prevention and response increased. Students were confident in injecting an overdose person with naloxone, as they were also confident in just dealing with an overdose. Researchers also found that these results lasted for up to 12 months in students. In the case of Ohio, Ohio has the 12th highest drug overdose mortality rate in the United States. And opioid policies have mostly been ineffective in Ohio. However, they recently found success with buprenorphine policy. So researchers investigated the implementation of buprenorphine in addiction treatment from the payer and provider perspectives. In this case, the payer perspective is county and state boards, while the provider perspective is first responders. What they found was that county boards, the payers, promoted buprenorphine use to improve clinical care and reduce overdose deaths. But that should be obvious. They also found, pretty interestingly, that both providers and payers cited the same common barriers to buprenorphine implementation. They cited negative attitudes towards the use of agonist pharmacotherapy, the payment environment, and physician prescribing capacity as all common barriers. Next, let's look at Florida. From 2003 to 2010, Florida experienced an increase in pill mills. Now, Florida created several laws to deal with these mills, and researchers wanted to see if these laws would end up being effective. What they found was that the laws enacted by Florida saved an estimated 1,029 lives from prescription opioid overdose over a 34-month period, and that these reductions in death have continued to grow. But enough with specifics. Let's look at a more broad study. Shalini Wickramatulake and a team of researchers looked at how each state is handling the opioid crisis in the context of the entire United States. They also looked at the District of Columbia. The team used data from the 2015 National Association of State Alcohol and Drug Abuse Directors web-based questionnaire to formulate their own questionnaire. They then handed out this questionnaire to state alcohol and drug agency directors and designated senior agency managers. So what they found was pretty interesting. For every single agency, they all cited that drug misuse was a high priority. They also all had their own unique ways of handling the opioid crisis while also sharing some public policies from other states. As we can see here, 29 states have increased funding for medication-assisted treatment of opioid addiction, 28 have expanded the availability of naloxone, 26 have established guidelines for safe opioid prescribing, and so on and so forth. Here's the chart from the study, and if you look at, I think it's 11th from the top, you can see Georgia. Now, Georgia educates the general population and adolescents on the risk of opioids. They also have a Good Samaritan law. However, they do not have access to naloxone or require prescription drug monitoring program reporting, which is pretty interesting. And here are the rest of the states. So what does all this mean? Well, as a whole, the United States has a wide array of policies aimed at tackling the opioid crisis. They know it's a problem. But these policies differ wildly from state to state. States will obviously need to continue to improve and increase the common policies like the prescription drug monitor program reporting, buprenorphine access, or naloxone access. However, they will also need to find their own unique solutions to their own specific problems. And here's my works cited.